first we need to do a little neurophysiology. So I need everyone to learn a little bit about brainwaves. So these are 4 different types of brainwaves. And the ones that we're most interested in ADHD is going to be the theta and beta waves. If anybody's relaxed or anyone's doing their meditation, or if anybody's maybe taking their theanine before this presentation, they would have more alpha waves. But what has been known for a long time is that there is a very distinct pattern of those individuals with ADHD, we've known since the early 90s, of differences in the theta to beta ratio. So theta waves are those daydreaming, those brain waves. So think of theta as daydreaming. If you are thinking of what you're going to have for dinner when you're at your first meeting at work, your theta waves are high. If our ADHD child is looking bored and staring out the window, their theta waves are high. If someone's paying attention and focusing, their beta waves are elevated. So beta waves are attention, theta waves are daydreaming. So if you think about it, what is the obvious ratio for our ADHD kids? Is increased theta beta ratio. And this is again, been studied many times, and those individuals with high theta to beta ratio are very likely ADHD. We looked at this for a number of years in our office. We looked at this ratio, and it was a very significant predictor. And there is both good research over many years looking at this theta to beta ratio as a predictor of inattention and diagnosis of ADHD. So just think about it for a minute. We're going to keep going over this for the next 10 slides. Theta waves, unfocused. Beta waves, we're focused. So if we want to help a child with ADHD, what do we want to do? We want to decrease that theta beta ratio, which means we want to decrease theta waves, increase beta waves. Okay, so how do we do that? Well, many of you know about neurofeedback. So in the 1990s, we did neurofeedback in the office. It's pretty cool. We teach kids, we taught adults how to control these brain waves. And the programs did what we wanted it. It helped the child decrease theta waves every time the theta waves decreased, even though they weren't aware of it. Got a little ding, a buzz, or a red light going off, and that positive feedback, the brain kept continuing to do that. So we taught kids how to do that, and the research has been around, and guess what? Neurofeedback has level 1 best support for the treatment of ADHD. 2012, average age of 10, 30 sessions of neurofeedback compared to methylphenidate or both, and neurofeedback was as effective as medication.